Hello, and welcome to Public Health 105, Introduction to U.S. Health Systems. Before I begin our first lecture, I want to go over some of the books we will be using in class. So the first book that we'll really be focusing in on is American Healthcare by Ezekiel Emanuel, and you'll have quite a few readings early on through in this book, as well as in The Great Influenza. The Great Influenza is available to you through CAT courses in a PDF version. You will have to purchase the American Healthcare. And then the other book that is I use quite a bit in the last half of the class is Which Country Has the Best Healthcare, and also by Emmanuel. I recommend getting the American Sickness. It's not a very big book, but it's not required, and I'll refer to it through those lectures. The book that I'm using quite a bit for this lecture, however, is Medical Bondage. I do recommend it. You don't have to purchase it. I think you can probably get some of her lectures if you Google Deidre Cooper Owens. But it is a very good book. It's hard to read. I'm going to tell you that right now, at least for me. But it really gives you some background on why there is so much racism and injustice within our healthcare system, and how it stemmed from from day one of our colonization of the Americas. Other readings and materials for the lectures are both linked in the lecture itself. I try to make sure I do that. I might miss a couple, but there will be in the syllabus, especially if they're a required reading. So I'm going to shrink myself so you don't have to watch me. And we are going to get into Lecture 1, Colonial America to 1910. I have broken up these lectures. I'm hoping that they're short enough that you can just grab and go with them. They will be available through CAT courses, as well as the audio version will be available through CAT courses. I know this is crazy times, and we need to have different means of getting the information to you. Excuse me. Okay, so let's get into this. So of course, we all know before Columbus or any other Europeans came to the United States, we already had an indigenous population. Although we don't have exact numbers of the populations, we do estimate it was between 50 to 100 million Native Americans were here prior to colonization. So we did have multiple waves of migration from the New World, and with these multiple waves did come multiple diseases. And we'll briefly go over some of those diseases. I'm not going to go really in depth. They are in the slides. You can look at them whenever you feel. I'm not going to read off every disease that we brought. It's just too much. These populations were already pretty culturally advanced before the settlement by the Europeans. I don't think we emphasize that enough. They already had their own forms of medicine that worked reasonably well for that time, especially for the diseases that they knew of. Now, of course, when we brought new ones, there was nothing for them, but we need to recognize that they were already advanced civilizations, just not in the way that Europeans were advanced, but they were perfectly fine. So another thing to realize that they did manage their environment extremely well. In fact, we are now looking at the way that Native Americans first managed the environment and altered, mostly with fire, the environment and we're starting to repeat, hopefully, some of their knowledge of their environment. An example of this is in New England, where they would use fire to for clearings and to clear the underbrush, and they didn't have the issues that we have now. Okay, so after Columbus, however, we brought many infectious diseases, and most notably, of course, is smallpox, where we devastated Native American populations. But it wasn't just smallpox. I mean, we brought typhus and malaria and tuberculosis, mumps, yellow fever became huge. And I think the next slide kind of shows some of that. However, smallpox was devastating to Native populations. It killed 95 to 98% of the indigenous population. And this is even prior to the Mayflower. However, smallpox deaths in Europe were pretty high as well, but it wasn't killing 95% of the population because in Europe, everyone was already exposed. And this is just 1 year, the death rates within 1 year. Of course, we're seeing high numbers within young people, but of course, there weren't very many people at 90 at that time, but it's still less than 1% of the population in London. Other diseases and what they are, in case you come upon them. Pneumonia, of course, I didn't put in here. Of course, that's just a lung infection. And infections were some of the highest rates of death. And then this is just kind of giving you an idea of what the different diseases are if you happen to see them in a reading. You might be quizzed on some of them, but I know dropsy comes up in some of the readings. So then there's those epidemic diseases such as smallpox. Cholera was huge. And of course, you've probably heard, especially in your intro to public health class, they talk a lot about cholera. Yellow fever was big in the United States. It is transmitted by mosquitoes. And of course, at the first, they didn't know how it was transmitted. Now we have pretty good control, but we still sometimes, I think in the last couple of years, we've had some outbreaks. So it still comes up on occasion. Influenza, of course, and then malaria as well. So in the 1800s, you'll notice as you go through here, yellow fever comes up a lot. Fevers are a big thing. We don't know exactly what this fever was. It was probably some sort of yellow fever. It's because it started by a river. And then, of course, cholera, typhus, yellow fever here again. And cholera within the cities was huge at this time. And then towards 1850s, we're seeing mostly cholera, influenza, and then typhoid hit. And this is where we had Typhoid Mary, of course. So Mary was she was a cook in high socioeconomic status homes, and she did not know she was a carrier of typhoid. She didn't know she was a carrier, but she was also the cook, so she easily transmitted the disease. And she denied that she was a carrier for a long time. Finally, towards the end, they ended up arresting her and putting her on an island off of Long Island, where she spent the rest of her life. So when people talk about their rights not having any rights because they have to wear a mask, well, at least they're not Typhoid Mary, I guess. Of course, 1917 is the Great Flu. or influenza, and we will talk more about that as well. So life expectancy in the United States was on the steady rise. Um, of course, it had this bump here. This is, of course, is our Civil War. And so we did lose a lot of men and women. But if we hadn't have had the Civil War, you can see that it would be continue on an increasing life expectancy track. So this is so maternal health is often used as a proxy for overall health of a region, area, communities. And the first thing you'll notice is we don't have any real data for Black women in there from until the 1950s. And this, of course, is because of slavery. But this has also led to a lot of inconsistencies in our data, as well as just the overall racism against African Americans within our system. And I will continue to speak on this as we move forward. So when you look at it and just look at the raw numbers, and we're going to look at 1850. So birth rates among African women were higher in 1850. Of course, we still had slavery at this point. But then when you go down to 1900, which is 50 years or 40 years after slavery, not even, birth rates were still higher among African American women. However, and so were fertility rates. However, when you move over to life expectancy, we're still seeing life expectancy not as high among African Americans as it is among white people. And we still have this discrepancy. Like we can't say that we have even come close to closing this gap because we haven't. And then infant mortality rates, again, incredibly, it's just heartbreaking, but much higher among Black populations than they are among white. And that has still an issue today. We'll continue on this subject for a while. Interestingly, though, slaves, actually, Onesimus, I think is his name, to be exact, taught colonialists how to control smallpox in the early 1700s. Did they use this information? Not really. So smallpox was actually brought over to the colonies on slave ships. And it must be noted that there were just more slave ships in and out of the colonies. It's a part of our history that we need to recognize. And it was, of course, all diseases were easily transferred among enslaved people who were packed into these unsanitary quarters and were able to pass these diseases readily. And then once they were off those ships, they then would pass those on to the colonists at their destinations. So, and of course, we've already said smallpox destroyed Native American communities that still really did not have any immunity to the disease. So Onesimus was an African slave, and he was owned by Cotton Mather. And many of you probably recognize Cotton Mather. He was a Puritan minister in Massachusetts. I believe in Salem and Boston. Anyway, so what he taught Mather how to prevent smallpox by inoculating people with the pus from an infection, and they would cut a person's arm or wound them in some way and then rub the pus into that to the opening, and this would allow enough of the disease to get within the system to start a so that they would have start building an immunity, but not enough to make them sick. And Cotton Mather was um, would love this. He was going he wrote papers about how to prevent smallpox. He did he would inoculated his whole family. I think he inoculated most of his village. However, due to racism, most people did not trust that this was a legitimate way to stop smallpox, and pretty quickly it fell out of favor. But notably, in um, uh, one of our first ladies, and it's not going to come to me. Her name is not going to come to me right away. Anyway, she inoculated her whole family with the smallpox virus, as well as I believe she did measles as well, and it was John Adams. It's his wife, and sorry, her name is not coming to me for some reason right now. However, we do have an ugly truth within the US health system, especially among medical advancements within the system. Slaves were often used as for medical experiments. I'm using Sims and Nathan Bozeman because their data was more easily accessible. However, if you look into this further, you will find that many Native or many African American populations throughout the Americas and in the Caribbean were used for experimentation. Excuse me. It's just I could not find names of doctors and to really put a finger on like who is doing this, why, that kind of thing. But we do have a lot of documentation from Sims and Bozeman. So actually, Sims is known as the father of American gynecology still today. We'll see if that changes. I don't know. So he operated on enslaved women without their consent or without anesthesia. Granted, anesthesia was not available at this time, but the key here is they were not able to say no. So he actually perfected a surgical cure for the vaginal fistula. This is a pretty serious thing that happens to women, especially at this time, because they did not perform C-sections. They would allow women to continue in labor for extended periods of time, especially low income and enslaved populations. And what happens is there becomes a tear between the bladder and the vaginal wall caused by the obstructed labor. And with this tear, the women then continue to drain urine. They have no control. And this leads to many things. When white women would just become outcasts in their community. Enslaved women would not necessarily become outcasts because they still had to work. It didn't matter that they were getting infections and that they were in pain all the time. That didn't matter. They were enslaved. They continued to work. But of course, this was a problem for their owners. They did not, so they put a lot of pressure on doctors to find a cure for this problem. Because also they could not breed anymore, and that's exactly how it's written in the papers. So women with this problem could no longer have children, and that was, of course, a huge problem within from this. So today it's actually still reasonably prevalent within low income communities in non-industrialized nations. Um, it has been over 30,000 have been reported in a year in some African nations. Of course, those are only the ones that are reported. So if they're in really small villages, they may not even be reported on. Dr. Sims performed over 30 on one slave alone. He performed over 30 surgeries, all without anesthesia for over 5 years. So she would have a surgery, maybe heal up a bit, and he would give her another one and another one and another one. So it's just horrific. And Nathan Bozeman did the same. And he did find a surgical cure for the vesicovaginal fistula, which did in turn help many women down the road. The problem is these were women who were enslaved. They could not give consent. They were put through this continuously. And often these enslaved women also became the nurses and surgeons performing these surgeries, because many of the local doctors who were originally helping Sims and Bozeman stopped. They just couldn't take it anymore. And they thought it was cruel. And so for other doctors at this time to state that and us to have reports on this, you have to think it was pretty bad. So, however, once Sims found the surgical cure for vesicovaginal fistula, he then returned to New York and to serve a wealthier white clientele and make a lot of money, right? But there was definitely something missing in in Sims's personality. His code of ethics was pretty off, because he continued among this wealthier population. He would treat what they called hysteria, which could be anything, by removing women's ovaries, and again without anesthesia. He also continued his research on perfecting the vaginal vesicular fistula by opening the Women's Hospital in New York. Um, um, and of course, at this time, it was believed that poor women and slave women definitely had less value than the white wealthy women. So they were never going to experiment on wealthy white women. They did continue their experimentation on poor Irish immigrant women. And at this time is when Sims developed the speculum. And again, another woman, Mary Smith, received over 30 surgeries, again for vesicovaginal fistula, as well as many women would get hysterectomies and never be told at this time. So, medical practice in itself at this moment in time was just really in disarray. Medicine was actually considered a trade, not necessarily a profession. and there were no medical schools. It was a more of an apprentice situation. Often clergy acted as doctors. So in the 1700s, they believed that the body had four elements. There was blood, which was formed by the liver, phlegm, which was formed by the stomach, melancholy or yellow bile by the spleen, choler, which is black bile, by the gallbladder. If a body had too little or too much of any of these, that's when diseases would happen. So the body had to be in complete equilibrium among all of these different elements. So basically, a physician's job at this time was just to identify which was out of balance. So there were different treatments. So and some of them are interesting. So for scarlet fever, people would be kept in a scarlet bed curtains in a bed with scarlet bed curtains, so and enclosed. And really, so with scarlet fever comes a migraine. So you can see how maybe being enclosed, I don't know why scarlet, but the curtains had to be scarlet, but that was the thing. Maybe having being in the dark would be helpful and maybe help their headaches. I don't know. So jaundice was treated with turmeric, which is a yellow powdery powder herb that is still used, not for treatment of jaundice, but in flavoring. And asthma was treated with the lungs of a fox. So you would eat the lungs of a fox. So they believe that fever was caused by the blood. So bleeding was usually the preferred treatment, and it called for the removal of 10 ounces of blood. And it's thought that the circulatory system held 400 ounces of blood, but actually we know now our bodies only held about 160 ounces of blood. And we actually think this is what led to the death of George Washington. He was actually bled to death. So the typical medicine cabinet would have just different herbs in it. And some of these we have actually found can be helpful, but many, such as arsenic and mercury, not so much. So in primitive practices, in surgery, as we've already discussed, there was no anesthetics, there was no sterilization. So barbers often were the surgeons of their time. And so when you go to, and you don't see it quite as often anymore, when I go home, because I'm from a small town, our barber still has the red and white stripe pole. And that actually indicated that the barber was a surgeon. And the red stood for the blood and the white are the bandages. So just now you know. So the places of care were generally in people's homes. Medical care by doctors was really not much better, and in some cases worse than just by staying home and staying away from the doctor, doing whatever else you could think of. So there are two schools of medicine. There's the orthodox, the intake and outgo, which was emphasized by bloodletting, purging, high dose injections of enemas containing mercury, stuff you probably don't want to do. And then, of course, there was the holistic, which was emphasized by nature and plants, rarely fatal, a lot of bed rest, steam baths, eating plants. I think I'll always go for the holistic, especially at this time. And this was pretty common both across Europe and across the United States and Canada. So this led to, because people obviously did not trust doctors. You go to the doctor and he's just going to cut you up and let you bleed on the floor. Actually, they didn't do that. They actually collected the blood and they look at it and they smell it. It's crazy. Um, but it began the rise of manufacturing led to these secret formulas that led to patent medicines. This led to a hugely profitable industry after the Revolutionary War. So like the cocaine actually works. They still use cocaine when you get your injection. If you go to the dentist and they, how they kind of numb. If you have a good dentist, they'll numb a little part before they stick the needle in. That's still cocaine. It's still because it is numbing. So with the combination between poor health and so few doctors within the United States and the lack of education and the increase in superstition led to many of these patent medicines. It also led to the rise of the newspaper because that's how they would be advertised. You could buy you could buy these medicines through the mail, or they would tell you the snake oil salesman is coming to town, be there and buy your bottle of whatever they were selling. So the result of this is the suspicion of physicians just grew. Physicians were also soon replaced with the druggist. And the roots of many current drugs are actually, drug companies are actually from this time. So Squibb actually started here in 1858, Pfizer 1849, and Pictures, which is now Sterling, actually started at this time in 1868. So they all of our big pharma actually started as a result of these patent medicines. Results also became, so this was also became a rising concern of our government. Physicians, druggists, and patent medicine manufacturers would start to band together. And this led to the American Medical Association in 1847 and the American Pharmaceutical Manufacturers and Dealers Association in 1852. Of course, and then there's the Propriety, I'm not speaking today, Association in 1881. So of course, we still at this time there was a lot of disorganization among the institutions. So doctors still were independent practitioners. They did dispense some drugs. They usually provided primary care to the poor, but they were independent of hospitals that were staffed by new medical students. Mental asylums at this time were seen as the responsibility of the state and local governments. Soon all people were sent to state asylums, and however, as you know, most of these were kept horribly. They were dreadful conditions. Hospitals began as poor houses in Philadelphia. They really just wanted to clean up the streets. So in Philadelphia, Boston, New York, and other big cities. Basically, the purpose was to remove ill from the streets, but to really remove everyone that they thought might be ill or whatever. And about 75% of those people who entered these entered hospitals died. So no one really wanted to go to the hospital at this time. And there was also unstable demand. Of course, there was an uncertain quality of care. It really depended on who your local doctor was. In urban areas, there was better quality care and there was more physicians. In rural areas, poor quality physicians usually, and much of the care for people was provided just by their families. It was also very expensive. Doctors could only visit 1 or 2 patients a day. They didn't have offices. People didn't come to them because everything was so spread out. Farmers were never going to miss a day of work, so the doctors had to go to them. It resulted in it was hard to keep a full-time practice going. And the medical salaries for this reason were very low. So I actually, my great grandfather was a rural doctor. He came from Ireland. He was actually trained in Edinburgh, which before I started really doing research in our medical history, I didn't realize that he was probably one of the best educated doctors in the country at that time. But they came through Canada and down through North Dakota. So because he was in North Dakota, of course, there's not that many people, but there's lots of cows and lots of animals. So he actually, in order to provide for his family, was not just the doctor for the humans. He was also the doctor for everything else on the farm. And that was pretty common. And my grandmother would tell stories about, he rarely was paid in cash. He was usually paid in livestock or eggs or something like that, which was probably fine. They seemed to have lived quite well, and they got by. So it was probably fine. But that's how most of the rural doctors would operate. Medical education to 1850, medical training was basically just an apprenticeship. There was very little formal education. So you would go from high school, like maybe you would be educated up to 8th grade, possibly, and then go work with a doctor to be formally trained. And from 1850 to the early 1900s, was the beginning of many medical schools. They're pretty inexpensive to operate because they would, the revenue came from students' fees plus fees from patients. However, it was a poor source of education because at this time there weren't labs, no clinical observation, no standards how to become a school. Often it would take 4 months to 2 years. There was no consistency. And there was low or no entry standards. So you could become a doctor and not know how to read. That was kind of common. So then we have the Flexner report. It's also called the Carnegie Foundation Bulletin number 4. So this took place in 1910. And it was a landmark report of medical education across the United States and Canada. And Flexner called on American medical schools to enact higher admissions and graduation standards and adhere to strictly to protocols of mainstream science and their teachings and research. He leaned heavily on schools in the medical schools in Germany and Edinburgh, who had already developed strong curriculum for doctors. However, this also caused many Black universities to close their medical schools and again create a gap in both education and medical and African Americans having equity within the medical system as a whole. Although this is an unintended consequence. What Flexner, and you will know, there is a link to a podcast on this specific problem about how this happened because of the Flexner report. And so you will get more information on this. But what ended up happening is, of course, at this time we were still the United States was still segregate. Oh my goodness, segregated. That does not sound right. I am not speaking well. Um, and so African Americans without African American doctors would not get medical care, period, most of the time. It also caused a strict adherence to the biomedical training, which led to not so psychology and mental health were not focused on at all. And homotherapy and other traditional medicines were not allowed within the curriculum because they were not scientifically tested. So here are some other readings for the Flexner report. And this is the stuff you missed in history. You can follow that for the more on the Flexner report and how it affected the African American medical schools and racism in education, telling the full story. This is an amazing interview that kind of breaks down all the racism within not only our amongst the African American population, but also Hispanic and Native American. So we did have quite a few advances in medical knowledge in the late 1800s. So nitrous oxide to help was first employed by dentists to put people out so they could do their pull teeth. Hand washing, amazing. 1847, however, it did not really, in fact, there's another podcast on that. However, it didn't really make it into the United States until the 1900s. Pasteur, of course, pioneered germ theory and the use of carbolic acid to wash wounds is 1865. And of course, we have the discovery of the X-ray in 1895. So this is the end of this lecture 1. The next lecture is from the 1920s to the 1970s, and I will be uploading that shortly. So either enjoy the rest of your day, or if you're going to listen to the next one, good on you. And I will see you all soon. And